So sacroiliac joint injections. The sacroiliac joint is a very large joint which is at the base of the spine. This is obviously the spine. It's made up of the cervical spine, thoracic spine, lumbar spine. Right at the bottom there is the sacrum down here, and that is essentially joined to the pelvis by two joints on either side, which are called the sacroiliac joints. Now, some patients get a very significant pain from the sacroiliac joint, and that's referred to as sacroiliitis. It's incredibly painful, it really can be, and I've had patients describe it as essentially somebody taking a needle and stabbing it into the base of their buttocks, essentially. It can be a really, really uncomfortable condition. For this procedure, we will bring the patient into hospital as a day case. They'll be put under an X-ray. We're also starting to do this with ultrasound as well on an outpatient setting. The procedure can be done under local anaesthesia, or it can be done with a small amount of sedation if necessary. And essentially, either with the X-ray or the ultrasound, we identify where the sacroiliac joint is. We identify that, we clean the skin, and then we anaesthetise the skin with some local anaesthetic, and we put a tiny little needle inside the joint, and then we administer a mixture of local anaesthetic and cortisone or steroid preparation. We use things like depomedrone and triamcinolone. By doing that and using a reasonable volume of fluid, we can essentially fill the sacroiliac joint with the cortisone and reduce any inflammation, reduce the sacroiliitis. So as with all procedures, there are risks and benefits. The benefits are pain relief, takes about 10 to 14 days to work, sometimes less, sometimes more. Risks: failure, local bleeding, bruising, infection, discomfort, they're all minimal. You may get some numbness, weakness, pins and needles afterwards. That's just the local anaesthetic spreading. Otherwise, it's a very simple, straightforward procedure, and it can give excellent pain relief.